Reagan Robertson here with Productive Dentist Academy. Get ready to join your favorite podcast hosts, Dr. Bruce B. Baird, Victoria Peterson, Dr. Chad Johnson, and myself, Reagan Robertson, at the nation's #1 dental business course that guarantees practice growth. That's right, full immersion CE, so you can consistently produce more and align your team for results without compromising excellent patient care. Registration is now open. The tuition cost is $2,195, which is ridiculous because it's regularly $5,528. Hop on over right now to www.productivedentist.com/workshop to grab your registration today. Again, that is www.productivedentist.com/workshop. If you cannot wait and you have to have it right now, email Brent, B-R-E-N-T, at productivedentist.com. That's Brent, B-R-E-N-T, at productivedentist.com, and we will save you a seat. I look forward to seeing you there.
Hello, everyone. This is Dr. Bruce B. Baird, and you're listening to the Productive Dentist Podcast. In this podcast, I will give you everything that I've learned over the last 40 years in dentistry, working with thousands of dentists. I'll tell you, it's not that my way is the only way. It's just one that has worked extremely well for me, and I'd love to share that with you so you too can enjoy the choices and lifestyle that productivity allows. More time for things you love, increased pay, better team relationships, and lowered stress. Let's get into it with this week's episode of the Productive Dentist Podcast. Welcome to the Productive Dentist Podcast. This is Dr. Bruce Baird. Today we're going to be talking about something that is super important to me, something people call me a master delegator. It's delegation. It's how to work with people and get them to do the things that they really want to do without me doing everything myself. And we talked about leadership on the last podcast, and I think leadership, part of leadership is giving people responsibilities of things that they can do, that they can be proud of. And what kind of things are we talking about here? Are we talking about, prepping teeth? No, that's what we do as a dentist. Are we talking about, you have to look at your Dental Practice Act. There are some states that allow hygienists to give injections. I think there's 40 some odd states that allow that. State of Texas, unfortunately, is not one of them. If they did, I'd hire a hygienist just to go around and give injections for me before I go in and do the preps. There are other places that allow expanded duty to do fillings that allow a lot of different abilities. State of Texas is not one of those. But what things can I delegate? What things can I do? And first of all, look at it as anything that I can delegate. They taught me how to, for instance, I'll give you an example. They taught me how to adjust a crown out of the mouth or adjust a crown in the mouth. Well, if it's cemented in the mouth, I can't have my assistant go in with a high-speed handpiece and adjust that crown. But they can certainly try that crown in. I teach them about balancing side prematurities and what the working cusps are, and I'm constantly training and teaching so that they can do it just as well as I can. And they will come get me and they say, hey, this contact is, it's really heavy, but I just don't feel comfortable taking any more off. Oh, no worries. Let me come in and look at it. I'd rather be the one to wipe the contact out than them, and they'd rather me be the one to wipe the contact out than them. But I give them those responsibilities. They take a pre-cementation x-ray. They'll come get me, and they know what it looks like when it fits perfectly. They also know what it looks like when it's not fitting perfectly. And if it's not, they come get me, say, Doc, take a look at this. I go, oh, let me look. This contact's a little heavy. Let me just polish this contact with a wheel. Now let's take another picture. Okay, it looks great. It may be in a blue block phase if we're doing CERAC, or it may be in a finals phase, if it's just an all ceramic crown or something that's been done at the laboratory. But I want them to be able to do those things. What about an occlusal guard? What about, I like a ramp type occlusal guard where the patient goes into posterior disclusion and have anterior guidance with that. And that's something that I learned from Dawson back 35 years ago. And I like doing that because it basically deprograms the muscles. We can use our T-scan to find out, but mostly I can get them where they're hitting in the anterior regions and not hitting in the posteriors. When they slide forward, they're completely, or they have equal contacts in the posterior, but they disclude immediately when they slide forward or slide to the side. It's building them in, for instance, in a cuspid rise type of environment. I teach my team how to do that. Why? Because I want them to bring me I want to walk in, first of all, and look in the mouth. The patient's got their occlusal guard in, and I go, let me take a peek. And I look, and there's dot, 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 and I see the ramps, and I see where they do it. I don't need to be the one in there doing that. Why? Because someone taught me how to do it. Why shouldn't I teach them? It's something that they're taking out of the mouth, doing outside of the mouth. Pack and cord. This is how, we pack cord. We rarely pack cord. We do an impression technique called the H&H impression technique, which we'll talk about that in the future. But bottom line is we very rarely do we pack cord. There's so many other things that I delegate during the day. The first introduction of the patient, bringing them back. I have a lot of people that say the doc has to go in and say, I want to get x-rays. And yeah, that's true. I'm not having my team diagnose that they need x-rays. I'm telling them before the patient comes in. If I have a new patient that hasn't had x-rays taken in 2 years, then they know that I want a full mouth series of x-rays. So they talk to the patient, they take the x-rays. I'm delegating that. I'm not even coming in the room until everything is ready for me. Till every little bit is good to go. Setting up, for example, for just regular treatment. If I'm going in an implant, we're doing an implant surgery. I want everything that we need in that room. I delegate to them. I'm not looking in drawers for things. It's really part of their job. It's part of their description of what they do on a regular basis. But I want to make sure that they know if you're looking at a case that I start talking about grafting, that they've got all the grafting materials in, that they've got osteotomes, they've got, if I'm doing a subantral lift, they've got the things for those things. They may have my, certain type of burr that I like. Everything is set up. I delegate those things. I delegate things in the business part of the office. I don't want to sit and do QuickBooks, and I don't want my wife to have to sit and do it. What do? I find somebody I trust, and I verify that it's being done correctly, and I'm following through with them on a weekly basis. I'm not doing data entry. I'm not doing any of those things. Why? First of all, I don't want to do it. Second of all, I've trained somebody that I trust, and I verify that it's being done correctly. And by doing that, it takes that off my plate. My goal is to take really everything off my plate except visiting with patients, getting to know them, and doing the things that I have to do. Prep the teeth, make sure that the aesthetics are the way that I want them, planning the cases. I'm doing all those things that I love doing, and I'm delegating all the things that I don't like doing. Now, some dentists like to make their own temporaries. Why? I will tell you, we've had CEREC for over 20 years, and I used to do all my own design until I finally figured out, and I use the excuse, I want I use it as a marketing time with the patient. Look at this, Bob, look at this. Wow, isn't that cool? Well, I taught my team how to do that. Now they talk to Bob and they go, Bob, look at this, how we do that. They go, and on a regular basis, I hear, what an amazing team you have. When you see that type of training with your team, all of a sudden patients walking in, they know they're in a different place. Go to your doc. You may not even see them. Now what you're going to do, you go to your physician, you're going to see a PA, you're going to see someone else. Rarely do you even get to see the doctor anymore. And so patients are used to you not doing everything. They're used to that. And so my challenge to you is look at the things that you do on a daily basis. Figure out how much time it takes you to do those things. And are these things that could be delegated? When you look at could you delegate it, you can't just say, okay, I want you to start doing this. what you have to do is you have to say, Gay, let me help you learn how to do the, adjusting of a crown outside of the mouth. Let me show you what I'm looking for. In other words, I'm not just going to delegate, I'm going to train, then delegate. So remember, the training opportunities turn into delegation. And the more I can delegate, I have to verify that it's done right. I have to verify that that temporary has beautiful margins, that temporary is polished so that the patient's tongue is going to be awesome. If you don't check those things and all of a sudden you start finding out, oh, the temps are falling off. Patients come in and they complain, it was really rough and it was, I have to go back and retrain so that I can still delegate. It does not mean that I have crappy people working for me. It just means that I probably need to do a little bit more training in order to delegate that responsibility. So I am, again, people have said I'm a master delegator because I'm able to be so productive. When people come into our office for the over-the-shoulder program, I hear the same response over and over again. It says, man, your team just, they do their thing, man. They know exactly where they're going. They know what they need to be doing. Has it always been that way? It happens fairly quick once I realized that my team wasn't there just to piss me off, that they really wanted to have things delegated to them. They wanted to feel responsible for things. They wanted to have a say in what's going on with the patients and how we treat them. They're proud to be in our office. And that's the kind of, that's the kind of place I want to work in. And so when we see these folks that are, patient comes in, like I say, and does have a complaint about something, I'm not going to bitch and moan with Gay or Summer. I'm just going to say, okay, well, I obviously I need to verify a little bit more that things are being done right. Maybe they've tried a new way and it's just not the way I want it done. I look at them and I'll look at those temps and I'll say, let's take a look at this. Notice how when we did the reline on this temporary, notice how the little rough edges and stuff, we really want to have those things polished, high shine, because trust me, I've had enough dental work done. And when that's in your mouth, your tongue just can't leave it alone. They get it and they go, yeah, we were behind that day. And my response to we were behind that day, I know, but there are times when I'm behind when I'm doing a crown prep, but I'm still going to consistently do the same crown prep. I can't change my results based upon if I feel like I was rushed. And in our practice, that happens very, very, very rarely. Why? Because we very rarely run behind. And I give my team more than enough time to do a great job. You can be very, very productive, by delegating. But it's not about things that are not within your Dental Practice Act. There are offices, like I say, that have their hygienists that are able to numb patients. And I've got to work with them on mission trips when we've gone down to the Dominican Republic, and I'm going, great, just numb them for me. I'll come in and take teeth out or do whatever. And it's just amazing. I would find a system, if I did live in one of those areas where they could, I would find a system where my hygienist could help us and numb people up. It's not about speed, but when I'm working, I want to be very highly focused on let's get the dentistry done. Let me do my preps. After using CERAC for so long, now that I'm not designing my own, I have my own smile designers that come in and they know how to show the patient what it looks like and they know how to do all those things. This is part of marketing, but it's part of delegation. I'm delegating those things, so I'm not sitting in the room. The one thing that I don't delegate at all is my relationship with the patient. A lot of people go, I'm not that good at talking to people or whatever. I'm just going to have my team be their best bud and everything else. I just don't do that. I want to build trust with my patients. I want to build a relationship with my patients. And so I take that very, very seriously. It may only take me 10 minutes, and we're going to talk more about the initial new patient interview and what I do. But I want us, I like working on my friends. I like working on people who generally I know, and I know what they're doing. I know what their life is about. I like working with people in my office that I know what their life is like and what their kids' names are and stuff. Again, 15 to 18 years ago, it really wasn't part of my MO. I would just come to work and say, this is the way things are supposed to be done. I'm paying you to do it. So get your ass in there and do it. And unfortunately, that is not a real good way of leadership. And it's really not a good way of getting people to want to do additional things that can help the practice and help the patients. And over the years, what I've noticed, and especially over the last 15 to 18 years, where my team, they've become more like family. They feel like they're the best at what they do, that there's no one else out there that can do what they do the way they do it. And they take pride in being able to do those things, as opposed to me going in and, I don't trust them, so I'm going to do every temp. I'm going to do it. And I see it day in and day out. When you get out of dental school, a lot of dentists do that. But I know dentists that have been practicing for 25, 30 years still do their own temps. It could be because they don't have a good, healthy new patient flow. They have nothing else to do. My suggestion is get your team on your side, get them, doing delegation. Following through with the things that you want them to do. And what you're going to find is you've got more time to do dentistry. You've got more time to do the things that you really want to do in your practice. So, that's what I have for you today. It's delegation. It's super important. Don't do it all yourself. You have people, hire people that you can trust but verify, and teach. Teach them how to do it the way you want it done, and then verify that it's being done that way on a weekly basis, a monthly basis, and pretty soon you're no longer dealing with those issues anymore. Okay, so look forward to the next podcast and talk to you soon. Thank you for joining me for this episode of the Productive Dentist Podcast. If you found this episode helpful, make sure you subscribe. Pass it along to a friend. Give us a like on iTunes and Spotify, or drop me an email at podcast@productivedentist.com. Don't forget to check out other podcasts from the Productive Dentist Academy at productivedentistpodcast.com. Join me again next week for another episode of the Productive Dentist Podcast.